Good afternoon, everyone. Thank you for the introduction. My name is Deepthi. I will be presenting on optimizing wound healing protocols using Einstein dosimetry for photobiomodulation therapy. Now, some of us know that in photobiomodulation therapy, usually 810 nanometer is used to heal diseases like oral mucositis. But we question, is there a wavelength that is working better? Or can we even optimize that? Well, we hypothesized that optimizing the clinical photobiomodulation protocol would enhance epithelial cell migration in vitro, leading to accelerated wound closure, thus improving wound healing outcomes. So our discussion starts with the Arndt-Schulz curve, which tells us that the level of stimulus is not linear to the action potential. You need to have a certain level of stimulus to have the highest action potential, thus the best treatment. We also take into consideration the Einstein dosage, which I will talk about in a bit. Further, the methods, we have a fully confluent dish with 370 to 400 K per dish. Then we do a procedural scratch overnight, and then we do laser treatments, and then the digital imaging. So the first experiment is to answer our first two questions. Is there a wavelength better than 810 nanometer? Secondly, can we optimize it? So we have a few wavelengths before 810 nanometer and after 810 nanometer, and each dish will have two different versions. Firstly, a normal time with 300 seconds each, and adjusted time through the Einstein dosimetry. For example, if you have a smaller wavelength, you will have higher energy, thus a lower treatment time. Similarly, if you have a lower or a higher wavelength, it will have a lower energy and thus a higher treatment time. Now the graph tells us the area covered at T0 when the laser treatment was done, and T12, the ending area. The higher the difference, the better the wound closure is. Now we can see we have conclusion that there are two wavelengths that is working better than the usual 810. We have 560 nanometer and 450 nanometer, as well as their optimized Einstein versions. So yes, the optimization is working. Second study is to validate our previous claims. So we investigate PBM signaling pathways via gain of function and loss of function approaches. We try and block ATP. Further, we try and also answer proliferation versus migration through both pathway blocking as well as the TGF-beta augmentation. Here you can see, yes, TGF-beta has a much higher closure than even 450 nanometer. Secondly, we can see that proliferation blocking N-acetylcysteine does not have as much closure as we expected it to be. Therefore, the main reason of the whole scratch assay is migration and not the proliferation. The third study is to again analyze our claims in hypoxic, diabetic, and infectious environments and see will the optimization work in those environments. And that was my study. I would like to thank my team, Dr. Praveen Irani, as well as my school, University of Buffalo, and ASLMS to give me this platform. Thank you.
So our next speaker is Fabien Maseli. Could you help me pronounce that? Fabien Maseli, thank you. And her talk is on characteristics of basal cell carcinoma subtypes, long pulsed 1064 nanometer ND-YAG treatment with optical coherence tomography guidance. Please come on up.